Hi, before we move on to the next dysrhythmia, I just wanted to make sure that you understand that when we have an arrhythmia, in this case, a first degree heart block, which is AV heart block, remember that the patient may or may not feel any symptoms at this time, but if you are monitoring a patient and has a cardiac dysrhythmia of this type, where you notice that the PR interval is prolonged, please make sure that you keep an eye on this patient because these arrhythmias tend to get worse instead of better. Now, they may happen and then come back and go away and come back, but this is a red flag. The heart is sending an impulse and is telling you that something is causing a delay, whether it be the lack of oxygen or blood flow to a certain part of the heart that's giving you this irregular dysrhythmia, or just a lack of oxygen. So the patient may or may not feel any symptoms with first degree AV block, but you should remember the parameters for cardiac output, the signs and symptoms for a decreased cardiac output. We've emphasized that, I believe. So make sure you look at the checkpoint questions, and I'll share the screen with you so that you can evaluate these. This is a in checkpoint question LO 8.2, out of these two, which do you see the prolonged PR interval? So if you look closely, using your calipers, you can measure from the beginning of the P to the beginning of the R right here, about 1, 2, about 3 little squares, more or less. That gives you about 0.12. Remember that one little square is 0.04. So it says 1, 2, 3, maybe 4, it's 0.16. It's well within the parameters, okay? So again, in this dysrhythmia, first degree AV blocks, the only characteristic is the prolonged PR interval. So let's look at the second one. So let's look at this one over here. So if you look at this one, okay, you may see 1, 2, 3, 4, 5, maybe 6 little squares. So this one is a little bit beyond the parameter. Okay. And so you notice that the prolonged PR interval would be the distinguishing factor. In this case, we have 1, 2, 3, 4, 5, 6. That's 0.24. So I'll correct myself here. This one has a variable PR interval. So this one's normal, this one's longer, this one is even longer. 1, 2, 3, 4, 5, 6, 7, 8, 9. It's a very long PR interval. And if you look at the next one, there is something missing here. There's a drop beat. So this is another kind of arrhythmia that we'll be looking into, right? But for right now, keep in mind that the prolonged PR interval greater than 0.20 is the defining characteristic of a first degree AV block. All right, so we will be moving on to the next one. Make sure you complete checkpoint question L 8.2.